Hi, it's Dr. Rod Story. Thought I'd give you a COVID-19 update. Actually, a very personal one. I'm recovered from COVID-19 myself, having tested positive about 14 days ago. Here's what I would tell you. It was definitely lousy. I had several days of fatigue that led into a bad, heavy chest cold and really bad sinus congestion. Some high fevers for a couple of days that then took a kind of turn more to a heavy chest cold. For me, because I have a history of asthma and some other lung situation, decided at that point to take an antibiotic called azithromycin and prednisone, and I think that made a significant difference in my course and helped me make a quicker recovery. Did a 10-day home stay with my family, and now I've been able to return back to work with minimal leftover symptoms. Strangely enough, really never lost my sense of taste or smell, which is interesting enough not as common as maybe people are looking for. What does this mean? You know, I would share with you my experience partly as a matter of encouragement. I'm now on the backside of this, and I have a good knowledge that I have now not only encountered this illness but overcome it, and I will have developed now significant immunity that actually helps me to break the link and reduce the spread of infection in our community. And I would encourage our people in our community that if you are low risk, if you are healthy, we now have a huge body of knowledge, hundreds of millions of cases that have been documented to show that almost everybody that encounters COVID-19 is not only going to get through this, but do it with very little risk and is going to develop significant immunity that will be a blessing to our neighbors and help us get beyond this, this pandemic and this fearfulness that we carry in our community. On top of that, I would also tell you that there is a growing body of evidence of best practices that are meaningful in helping not only reduce the severity of the illness, but also in helping keep higher risk individuals out of the hospital. And we've been applying many of these things, including the antibiotics and steroids, breathing treatments, and early oxygen use in many of our elderly patients who have been contracting this illness, have been able to stay home, and we've not, thankfully, had anyone hospitalized. We're really hopeful, and we think that there's now excellent evidence to be able to not only encourage those that are choosing to be able to go out in our community to be able to continue to do that, but also say that there are ways of taking care of people who might get this illness. Let me encourage you. We can do this. We can get through this together, and we now have the tools to be able to do that. I'm thankful that now I can share with you my experience and with confidence know that I have an immunity that will be a blessing to others. Thank you. This is Dr. Rod Story.